Changko penting untuk sendi. Okay, sendi very important because dalam sendi ada apa nama bahan yang meliputi hujung tulang? Cartilage. Ada cartilage. Okay, ada cartilage. And Changko mempunyai bahan mentah untuk pembinaan cartilage. Okay, as you can see there is one here. And selain daripada itu, kita ada apa yang dipanggil mengenai luka. Luka juga Changko penting. Okay, so sekarang ada ramai orang dalam lingkungan umur 50 lebih dan 60 lebih yang mempunyai masalah sendi. So you can give them Changko. Changko will be a good help for them. Okay, because Changko boleh membantu masalah sendi. Okay, so that is what we can see. And juga luka terutamanya di kalangan pesakit diabetes. Okay, di kalangan pesakit diabetes, you can give Changko because Changko banyak membantu pesakit diabetes. Okay, so inilah dia osteoarthritis mengenai penyakit sendi. Okay, selain daripada itu, masalah penyembuhan luka di kalangan pesakit kencing manis. Okay, and sekarang ramai orang yang suka makan painkiller. Tapi painkiller dia tak menyelesaikan masalah. Dia hanya memberi relief untuk sekejap saja, sementara saja. After that, masalah akan kembali. So it's best kalau kita boleh menyelesaikan masalah daripada akar. Okay, solve it from the roots. That's the problem. So this is what we have, the superstar Chana striatus. Okay, yang juga dikenali sebagai haruan. This is the snakefish. Okay, so didapati bahawa ia mempunyai banyak kebaikan. Okay, yang pertama, ia adalah antifungal dan antibakterial, anti-kulat. Dia mempunyai. Okay, very good. And juga boleh merawat masalah seperti eczema. Right? Anybody who knows, anybody got eczema, you can give Changko. Okay, osteoarthritis, saya baru cakap tadi, osteoarthritis dia punya cartilage sudah ada problem. So siapa-siapa, if you know anybody ada osteoarthritis, sakit lutut. Biasanya sakit lutut ini apabila dia naik tangga. That's where the problem will start. Very painful. Okay, selain daripada itu, yes, untuk penyembuhan luka, ibu-ibu selepas bersalin, especially cesarean. Okay, siapa yang melakukan cesarean, you can give them Changko juga. Dan Changko juga boleh mengurangkan kesakitan dan juga keradangan. Okay, boleh mengurangkan kesakitan dan keradangan. Okay, inflammation. Okay, so itu banyak kegunaan. Okay, kalau kita melihat ikan haruan, okay, so Changko can help. Okay, inilah dia. And all of this osteoarthritis, masalah sendi, okay, luka-luka diabetik. Okay, selain daripada itu, selepas pembedahan, bypass, you can also give Changko supaya, because bypass dia punya pemotongan panjang, agak besar. You can see tengah-tengah ini, quite big. So if you give Changko, the healing is faster. Even cesarean, you can give Changko. Okay, the healing is faster. Okay, and selain daripada orang yang kulit terbakar, burns, if selepas habis bypass, after habis cesarean, baru boleh. Balik rumah. Don't start in the hospital. Yes. Normally after about 48 hours, you can start giving. Yes, you can start. Yes, because it's 125 milligram, so it's 2 tablets in the morning and 2 tablets at night. So the total is 500 milligrams. 48 to 72 hours, because this is not antioxidant and this is not the one. For antioxidant, it's 72 hours. So once they go back home, they are a bit stable, dia sudah okay, dia stabil. You tengok dia 2-3 hari dia sudah stabil, then you can start the Changko. 2 pagi, don't need to give the hospital, because hospital a lot of problem. Then they will ask you what you're giving, and then the doctors will scold, marah, doctor marah, then jururawat also marah, then because hospital they're very strict. They don't like supplements. Jarak setengah jam, 1 jam. Standard lah, jarak setengah jam. Buatlah at least selama 3 minggu hingga sebulan. Let the luka sembuh. Yes. Okay. So 2 tablets in the morning, 2 tablets at night basically. Okay, so what is the benefits? These are all the papers, journal, and kita boleh melihat ia mempunyai asid lemak yang baik dan juga ia mempunyai banyak apa yang dipanggil sebagai asid amino. Okay, so as we can see, di antara semua ikan haruan, Channa striatus was the best. Okay, adalah didapati bahawa ia mempunyai arachidonic acid. I think I've told you all this in my previous talk. This is the old slide. I think Nabil chose the old slide. In my new slide, I gave you all about arachidonic acid, if you remember. Arachidonic acid adalah precursor, bahan mentah untuk prostaglandin, okay, dan juga thromboxane, dan ini boleh membantu dalam penyembuhan luka. It can help. Okay, and the paras arachidonic acid dalam Channa striatus agak tinggi, 19%. Is quite high. In fact, it's one of the highest actually. Okay, so that is the best among the 3 species. Channa striatus is actually the best. Okay, and this is basically for osteoarthritis. This is the journal. Okay, this is the journal. Dia banyak membantu extract. Okay, apa yang kita makan ialah extract, the mucus. You know, yes, not the lendir daripada ikan diambil. Okay, and they put menjadikan kapsul. Okay, so itu boleh membantu banyak dalam osteoarthritis, penyakit sendi. And normally osteoarthritis, sendi yang terlibat biasanya sendi lutut. Sendi siku not much. Why sendi lutut? Because berat badan. That is the problem. Okay, naik tangga semua, the wear and tear. The wear and tear is always with the knees. You see like a lot of people got knee problem after 60. After 60 always got knee problem. They always start. Now men also kena already. Dulu ladies now men also got problem already. Men also got start having knee problem. Gout is another one. That's another one. Men have got gout normally. Ladies won't have gout, but men will have gout normally. Okay, and this is the treatment. Didapati bahawa ia sesuai untuk arthritis. Okay, very good. Okay, ia boleh membantu. So dia membantu, as we can see. Changko boleh membantu. And then chondroprotective activity in rabbit. Dia menggunakan arnab sebagai model. Okay, and mereka mendapati bahawa ia boleh membantu osteoarthritis. So many diseases already. I hope you remember all. Okay, luka-luka diabetic, you can use Changko. Osteoarthritis, you can use Changko. Pembedahan, bypass, cesarean, you can use Changko. A lot actually you can use Changko. Okay, dia mempunyai banyak kebaikan. You see all the healing process. Okay, so ia lebih baik selepas menggunakan Changko. And selain daripada itu, this is very important. Okay, they use 3 things. Oops. Sudah, okay. Okay, so here what we have, okay, didapati bahawa roughness, kekasaran bagi cartilage. Okay, didapati bahawa Changko mempunyai kekasaran yang paling rendah berbanding juga dengan glucosamine. Glucosamine is another one. That is our competitor lah. Itu pesaing kita. Okay, because people will ask you, glucosamine boleh tak? Nowadays a lot, some people take glucosamine. Ada 2 glucosamine, one is glucosamine chloride, hydrochloride, and the other one is glucosamine sulfate. No, not really, but only the diabetics cannot take it. Some doctors say the diabetics cannot take it. So we have better. So Changko diabetic also can take, no problem. Yes, okay. So that is the problem. So ours is better. Changko is actually better. As you can see, the roughness is very low. Control, you see, the worst, teruk sekali. So this is what we have. Here, anti-nociceptive. Okay, properties. Didapati bahawa ia mempunyai sifat natural painkiller. Tak payah ambil ubat painkiller. We can take this one, the natural painkiller. Very good, and which is the highest as we can see. Okay, so this is what we have. Anti-nociceptive effect. Okay, so we can see ia boleh mengurangkan kesakitan. So apa yang kita gunakan ialah fillet. Fillet is the isi. Isi daripada haruan dan juga mucus, lendir. Kedua-duanya mempunyai sifat mengurangkan kesakitan ataupun anti-nociceptive. Painkiller as we can see. Wound healing, this is very important. Boleh mengurangkan kesakitan, mengurangkan keradangan dan membolehkan penyembuhan luka. 3 things. So you have to remember. Number 1, kurangkan kesakitan, kurangkan keradangan dan menggalakkan penyembuhan luka. As we can see, study mendapati bahawa Changko lebih baik daripada gamat. It's better. And it's even better than Savlon. Savlon is one of the brand which is used as a wound healing property because it's antibacterial. Yellow in color, yellowish orange in color. Okay, so it is even better than Savlon. Okay, so Changko is still better as we can see, and Changko which is wound aid lebih baik daripada krim yang lain ataupun apa-apa bahan yang lain untuk diabetic wound. So anybody who knows anybody with diabetic wound, we have the cream already. Sudah keluar cream? Oh, belum lagi. If you have the cream, very good. Because you can give both. Luar pun boleh, dalam pun boleh. Lebih fast, the effect is faster. Okay, so the cream is not out yet, but we have the capsule already. So we can start giving the capsule for anybody who has masalah diabetes, especially people yang ada stroke, yang selalu terlantar saja. Dia ada bed sore. I think you know bed sore. Bed sore is very bad. Sometimes it's very, very bad. So must be careful. Bed sore can become infected. And kadang-kadang boleh menjadi besar because of jangkitan bacteria. So you have to be very careful. Okay, so that is what we have. And selain daripada itu, yes, for bypass, CABG, coronary artery bypass grafting, we can use Changko. Okay, capsule for wound healing, reducing pain, especially a person after bypass, we can give them. Okay, at least let them come back home, let them stabil about 2-3 days, they okay already 3 days, then you can start giving them Changko. No problem, you can start giving them. Anybody who's going through bypass, gone through bypass, cesarean, I just told you the same thing. Anybody who went through cesarean, once they're back home, to fasten or to accelerate, mempercepatkan penyembuhan luka cesarean. Okay, because pemotongan berlaku. So to fasten it, we can use what we call as Changko. Okay, so selain daripada itu, so it's very good. That post-op, post means what? After, selepas operasi. Okay, kita boleh gunakan ini Okay, so that is one. Not only that, cosmetic appearance. Very nice. Because apabila you beri Changko, dia punya parut, okay, nampak sikit saja, very small and very fine line. Cannot see also. Because some women, they don't like the line. It's not very nice. So the cosmetic appearance is also very nice. Changko. Not only faster, but cosmetic also cantik. Dia punya garis sangat kecil, very small compared to biasa. So we have the cosmetic appearance also. Okay, so apakah kesimpulan? Changko boleh digunakan sebagai painkiller, I've told you already. Anti keradangan, yes. Antibacterial dan anti kulat, all Changko can. So this is the kebaikan. Okay, Changko dan juga krim luaran, iaitu the wound aid. Both of them you can actually use. Okay, antivirus no. Okay, at the moment is antibacterial and antifungal. Antiviral not reported yet. So we cannot simply say. Okay, so viruses normally don't disturb the wound. Most of the wound is very rarely is virus. Kalau ada luka, selalu yang membawa masalah dua, bacteria, kulat. These are always two problematic people. Virus normally is inside the body. They always look inside because virus is very delicate. Outside means they will die because exposed to the air. Virus cannot live. So virus very lembik. Dia mati cepat. Dia dalam badan boleh. Like hepatitis A, hepatitis B, hepatitis C, all inside the body. They can attack the body. Okay, so we can see after 4 days, all the wound becomes better. You see, 1, 2, wow, so much better after that. Okay, the healing is much more better. Okay, bed sore, this is the worst. Always happens to people who have stroke and people who are old age. Okay, usia yang lanjut, selalu yang teruk-teruk, they get bed sore. So if you know anybody, the market is very wide for Changko. You got a lot of people, got a lot of problems. Osteoarthritis, you got so many people. Anybody after 60, you can ask them to take Changko already. Not only for osteoarthritis, to prevent osteoarthritis. Mengapa mau tunggu osteoarthritis dan baru ambil Changko? Lebih baik elakkan. You have to prevent. Nowadays is to prevent the disease is very important. So it's very important as we can see. Okay, so this is diabetic patient. We can see how, wow, so nice already after 3 weeks, so much better. okay, with real cases. So we have a lot of testimony. Changko and the wound aid both can help, okay. Same thing, yes, and very nice. Okay, 55-year-old diabetic. Okay, so you can see after 1 month it becomes better. It's not overnight, 2 days you use okay already. It takes time. 2 weeks, 3 weeks, it takes time to become okay. Mengambil masa. This is very bad. Look at that, so much better. Diabetic patient on the leg. Most of the cases are diabetic patient. Okay, because diabetic patient dia punya luka lambat sembuh. Why? Because gula dalam darah adalah tinggi. When your blood sugar is high, then your your healing process becomes slower. That is the problem. So diabetic must control the blood sugar. That is very important. Okay, so this is basically, and the tablet, you see all of them, any questions you have, is always 4 tablets a day. Diabetic wound also 4 tablets a day. So it's 2 times a day, as we can see. Okay, so you can take whatever you want, but it's 2 in the morning and 2 in the evening. 1 capsule is 125 milligrams, so 4 capsules is 500 milligrams a day. Please do not exceed that. Okay, please follow the recommendation. And that's it. Very short and very sweet presentation today of Changko. So can we go back again one more time? Changko can be used for what? Number 1, luka diabetic. Number 2, cesarean. Number 3, bypass. Number 4, sakit lutut, osteoarthritis. Number 5, penyakit kulit, eczema. Number 6, antibacterial, anti-kulat, anti-inflammation. Number 7. So many things, 1 capsule can give all the answers. So you have big market because osteoarthritis itself is so many already. I think a lot of people will start taking because if osteoarthritis, they want to elakkan. Some people baru mula osteoarthritis. They are 58, 60, 61. That's the time the osteoarthritis will start. So baru mula you can start giving them because sekarang osteoarthritis ada 2 saja pilihan. Satu, you buat apa? You buat surgery. Knee replacement, kneecap replacement. But that one also, ada orang dia buat pembedahan, kadang-kadang berjaya, kadang-kadang gagal. There is no difference. And they end up with so much of pain, lagi teruk sakit. So pembedahan is 50-50. Second choice, dia bagi injection. You pergi hospital, dia inject dalam you punya lutut. Oh, that's very pain. Dia inject hyaluronic acid, sejenis bahan pelincir untuk sendi. That one also 50-50. Ada patient, ada improvement. Ada orang langsung tak ada apa. Wasted $1,000. One jab is about $1,000 I think so. 1,200. Some people it doesn't work. Wasted your money. Hyaluronic acid. It's quite expensive. 1,200 is a lot of money, you know. So if it works. It doesn't work. So some people go for the third one. What is the third one? Suffer, merana. Dia tahan sakit. Every day tahan sakit. They don't want to do anything. Takut pembedahan, takut injection, dia merana. But today we got the fourth one, which is Changko. So you can help the people who is suffering from osteoarthritis. That's
adakah di pasaran yang menggunakan lendek kenaruan yang sama dengan ini?
I'm not sure about that. Belum jumpa lagi. This is one of the ikan haruan pun ada banyak. I cakap ada 3 species tadi. But among the 3 species, the best, the highest of arachidonic acid, the highest of everything is Chana striatus. Yes, haruan pun ada banyak tau. Dia species berbeza. Haruan is nama biasa. You cannot use semua nama haruan. Tapi you mesti panggil dia punya species. Chana, ada Chana ini, Chana itu, Chana ini. Kita Chana striatus. Itu yang terbaik. People ask you haruan, saya pun haruan. So, apa you nak cakap? So you must say what is your species? Scientific name. You must ask them the scientific name. Chana striatus. That is the best. Yes. Yes, natural painkiller. Migraine, no. Because this is a migraine yes, the natural painkiller. Migraine or headache or any body aches, you can give them Changko. Can. But better if the pain is coming from a joint or a cartilage or something. You can try migraine. I haven't had studies, but since it's a painkiller, you can give. Okay, you can try for migraine. But if it's better for pain, for osteoarthritis, that kind of pain will be really good. Definitely. More effective. Okay, so that is one. Nowadays, migraine, what they do? Panadol. That is the best. Semua orang ambil Panadol. Apa-apa sakit badan, anything, Panadol is the best. No choice.
Kalau sakit dah bebas.
Cancer, bebas dari cancer. Boleh ambil tak? Boleh ambil Changko. Can. Pesakit yang sudah bebas daripada kanser boleh ambil Changko. No problem.
Kalau kanser boleh pakai.
Tapi you cakap sudah bebas, sudah selesai, no problem. Kalau sudah okey, dia masih ada sakit osteoarthritis, you can take, no problem.
Sakit buah pinggang tu boleh tak?
Boleh, no problem. Can. Normally buah pinggang, the worst yang menjadi lebih teruk is the painkiller. Painkiller menjadikan buah pinggang lebih teruk because beban buah pinggang akan bertambah. So that is the problem. Senggugut is what in English? Piles. No, hemorrhoids is piles. Period pain. Okay. Yes, like what she asked just now. Anti-nociceptive. Painkiller. So you can take that. Okay. Active sukan you can take because your sendi must be very good. Your muscle must be very good. Can, boleh. Unless it's very dislocated, then mesti buat surgery lah. Then cannot do much. If it's slight, you can still take. But if it's very bad, totally dislocated, then must go for surgery. Okay, but athletes, yes, one more group, very good. Athletes can take Changko because they need their joints must be very good. Muscle and joint, we got a lot of acid amino. Yeah. Yes, collagen also for the muscle, for the joints, for the muscle, okay, for the suppleness of the joint and the muscle. Cesarean. Can take, no effect, can take, no problem.
For aging?
You can take for aging. Yeah, definitely your skin got collagen. Our skin got collagen, what? Okay, for aging process to kurangkan. Yes, white hair. So can mengurangkan kedut-kedutan normally. Collagen is to reduce. Instead of going for Botox is so expensive. Very expensive. This is so much cheaper.
Macam ambil botok, dia boleh ambil Changko.
Boleh, no problem. Tak ada. Tak keluar, tak ada. You can take. Okay. Changko is better. Why? Because Changko is natural. This is very natural. It's from a fish. It's very natural. So you are taking it as a supplement. Yeah, taking it as a supplement. Okay, yeah. Mungkin a ligament. It can be a lot. Peha patah can be ligament, can be saraf, can be muscle. Mungkin tulang tak bersambung dengan betul. Yeah, of course you must go for check-up. Mesti berjumpa dengan orthopedic surgeon to buat X-ray to see whether any problem or not. Because sometimes the bone tak sambung dengan betul, itu pun ada sakit, very painful. Benjol. Okay. You must see what is it because you can't simply tell. You mesti tengok mungkin ada apa-apa masalah lain tak. Benjol can be a lot of things, it's very scary sometimes. It can be a growth also. Mungkin ketumbuhan. We do not know. So you must see a doctor. So you have to be careful. Kalau ada ketumbuhan, because lembut ada ketumbuhan, then problem. Mesti kena check. You cannot do that. Yes, Nabil? parti daripada dia punya fillet. Fillet is EC. Fillet is the EC. Okay, actually the parti is actually the lendir. It's the same thing. Dalam lendir ada parti, dalam English dipanggil sebagai extract. So apa yang you ambil ialah extract. You cannot this is not the same as pergi memancing dapat ikan haruan potong makan. That one lain already. Because that one you need to take so much of ikan haruan baru you boleh dapat. Ini dia ambil banyak ikan keluar dia punya lendir, dia pekatkan jadi ekstrak, jadi kapsul, baru bagi you makan. So it's concentrated. It is very concentrated. So it's very important. Melekat? What's the meaning of melekat? Oh, I'm not sure about that. I haven't heard of that before. I haven't heard of that. Yes, sir. Okay, I'll check on that. Okay. Layer. I'll check on that.
Tapi doktor, yang ada di pasaran tu bukan ikan haruan, ikan toman.
Yes, sir.
Yang ada di pasaran tu sebenarnya itu adalah ikan toman, bukan ikan haruan.
That's a different fish.
Adalah pati ikan toman.
That's a different fish. That's a problem. Haruan is, I know haruan for so many years they use for healing. Definitely, it's the best. You cannot go wrong. Haruan is used for healing for so many years. It's one of the best. But don't exceed the dosage. You have to take the dosage. But I don't think you need that much. I think 500 milligrams is enough. Yeah, you won't have any problem because it's nothing is from the fish. It's just amino acid and arachidonic acid. Nothing will happen to you. How long already? How long is that? Still not yet. Not yet. At least about 4 to 6 weeks. It takes time. It's very slow. Why? Because this is natural extract. You take drugs very fast. This one will take time. Take some time. Orthopedic, yes. Orthopedic memang. Because dia selalu ada masalah tulang, ligament, sendi. Always got that problem. Uric acid not yet. Tak ada no journal. Belum dapat. But can I use Changko for gout? Can. Why? Apa sifat Changko yang boleh membantu? Anti apa? Anti-inflammation. So I can use for gout. Gout also can. Gout can because anti-inflammation. Bisol is just a boil. Am I right? That's boil. Bisol is boil. That is an infection. Antibacterial also can. You can use because this is antibacterial. Antibacterial, anti-kulat.
So, I masih confused antara purin dengan uric acid.
Purin akan akhirnya menjadi uric acid.
First purin dulu.
First purin. Kemudian dia akan berubah, ada dia punya laluan biokimia. Akhirnya dia akan menjadi uric acid. Purin is a type of a bahan yang ada di dalam daging merah yang ada dalam seafood. Banyak, tinggi. So orang yang makan banyak purin akan accumulate dalam badan, akhirnya berubah menjadi uric acid. Uric acid akhirnya bila nilai tinggi, mulanya gout. So the only way to stop gout is to stop makanan yang ada purin. Yes, purin dalam badan purin apabila masuk dalam badan you, tukar menjadi uric acid. Purin dari mana? You makan ikan, you makan seafood tak ada uric acid tau. Dia ada purin. You makan purin. Purin will masuk in your badan and berubah menjadi uric acid. Bukan you makan uric acid. Mana boleh makan uric acid? Tak boleh. Tak ada. You makan purin. The purin will be converted to uric acid. So you can Google purin rich food. All the list will come out. So you have to avoid all that food. very little. And sumber yang paling baik iodine, makan garam yang ada iodine. Today they are selling iodized salt. I think you know about it. You know about it? Iodine untuk you punya kelenjar thyroid. Yes. Kalau you nak kelenjar thyroid you sihat, salah satu daripada hormon yang dikeluarkan oleh kelenjar thyroid memerlukan mineral iodine. Kalau kurang, then you have problem. Then you have hypothyroid. Hypothyroid, you punya makanan susah nak hadam, lambat. Badan you mula naik. Kulit you sejuk. Semua menjadi perlahan. Terlalu lebih, you dapat hypothyroid. Another problem. Makanan terlalu cepat bakar. Selalu kurus sahaja. Mata benjol keluar. Denyutan jantung bertambah. Laju. Too much of iodine. So iodine is just nice. Tak boleh lebih. You have to take medication lah. There's no choice. Tak ada. Tak boleh. You have to take medication. That's why you have to go for a blood test to know your iodine. Pemakanan biasa, the best source of iodine is garam. Garam yang ada iodine. So always buy iodized salt. So you get your iodine. Berapa garam you makan setiap hari? Itu cukup lah. Enough already. Cukup. That much only. That much of iodine only you need. Iodine you don't need so much. Semua, yes. Iodine pun you need very little. Cannot. You can take, but the best is salt for cooking. Because whenever, every day you cook, you use salt one. So you're getting the iodine. So it's enough, that much is enough. Iodine punya paras. You know how they will know from your thyroid? From the thyroid, they will know whether you are normal or whether you're not normal. Whether you're normal, you're up or down. Even women got problem thyroid. A lot of women got thyroid problem. Quite number nowadays. A lot of women got thyroid problem. They put on weight. The thyroid they become very inactive. Put on a lot of weight. A lot of people got thyroid problem. Yes, definitely. I baru cakap definitely. Terlalu pun you terlalu kurus. Terlebih kurang pun you become cannot. You say iodine is so important. Thyroid is very important. Thyroid is very important. Here duduk sini tapi dia sangat penting. The whole body it controls. Okay?
So Pak, tu tentang orang yang
Putih apa?
apa orang yang
Albino. Albino is totally different. Albino ialah orang yang langsung badan tak boleh menghasilkan melanin. That one kesian lah. That one is akibat daripada perkahwinan. Di antara dua orang yang pembawa. Dua orang kahwin, anak dia albino. I know one couple, dua-dua pun pembawa. Anak dua-dua keluar pun albino. Cannot do anything. Tak ada ubat. Albino, there's no ubat. Tak ada. Nothing. Gene, you cannot do anything. How to go inside and change the gene? Cannot do anything. Albino is langsung tak ada melanin. Langsung tak ada. I think you have seen orang pernah tengok tak? Semua putih, you have seen or not? Even the eyebrows are white color. Okay, I hope you enjoyed the talk today. We'll meet next week. One last question. Sleep disc is not this one. Sleep disc, you have to ask Abang Syarul, he can help you. Medi AFA is for sleep disc, not Changko. Okay, Changko can help you to reduce the effects of the nerves and the muscles and all can help you. But the main thing that will help you is Medi AFA. Okay?
Berkenaan sakit buah pinggang tadi, kita nak showkan berapa tablet kita
Sama, 2 pagi 2 malam.
tablet kita
Tak boleh lebih daripada dos. Dua-dua saja. Yes, not more than the dose. Please don't go more than the dose. Then you have problem. Cannot, tak boleh.
Kalau ambil lebih mati ke dia?
Tak ada, nothing will happen to you. But please, anything which is good, you cannot take more. You cannot eat anything which is good, also cannot eat more. You have to follow the dose. Tak boleh, dua-dua is enough. Because that is the dose that they work for all the study. They use 2 and 2. Yes, sir. You can try if you want. but normal dose is 2. You can try. Nothing will happen to you, Nothing will happen because it is just the pati ikan. The pati ikan. Whatever excess, your body will throw away. Buasir, no, you cannot take this one. Buasir is hemorrhoids, nothing. Purimax. Ya ke? Buasir, it depends because buasir got buasir dalaman, buasir luaran, a lot of different, it depends. If peringkat permulaan, you can still try Changko. Okay, you can try Changko. Okay, buasir is hemorrhoids. Luka. You can try Changko. If the luka is not sembuh, susah sembuh, you can try Changko because it helps wound healing again. Purimax will help to go out slowly, so the hemorrhoid will become lesser. Because buasir, one of the sebab is constipation, sembelit. Okay. Thank you very much, everyone. I see you next week with a new tajuk. Most probably is Max New. I think Nabil will do Max New next week. Okay. Thank you. I wish you all the best. See you again next week. Thank you very much. Okay.